What are the different types of urinary tract infections? Imagine your urinary system as a busy highway, with different parts working together to keep your body clean and balanced. When bacteria or other germs invade any part of this system, it can cause a urinary tract infection. These infections come in various types, depending on where they occur along the urinary pathway. The most common type is cystitis, which is an infection of the bladder. This often causes a burning feeling when you urinate, a frequent urge to go, and sometimes blood in the urine. People with cystitis might also feel pressure or cramping in the lower abdomen. Since it stays in the bladder, it is considered a localized infection without systemic symptoms like fever. Another type is urethritis, which affects the urethra, the tube that carries urine out of your body. Symptoms can include burning during urination and a discharge from the urethral opening. Like cystitis, urethritis is usually localized and does not involve other parts of the urinary system. When bacteria reach the kidneys, it causes pyelonephritis or a kidney infection. This is a more serious infection and often comes with fever, chills, pain in the side or back, and sometimes nausea or vomiting. Because it involves the upper urinary tract, pyelonephritis is considered a systemic infection, meaning it affects the whole body and needs prompt medical attention to prevent complications. In men, infections can also involve the prostate gland, known as prostatitis. This can cause pelvic pain, difficulty urinating, and sometimes fever. Prostatitis is part of the lower urinary tract infections in men and can be acute or chronic, depending on how long it lasts. It's also important to understand the difference between uncomplicated and complicated urinary tract infections. Uncomplicated UTIs happen in healthy individuals with normal urinary tracts and usually involve cystitis or simple kidney infections. Complicated UTIs occur in people with structural or functional issues in their urinary system, such as blockages, catheters, or weakened immune systems. These infections tend to be more severe, recur more often, and can be harder to treat. Medical experts also classify UTIs based on whether they are confined to the urinary tract or have spread beyond it. Localized infections like cystitis and urethritis stay within the urinary system, while systemic infections like pyelonephritis involve symptoms affecting the whole body, such as fever and chills. Understanding these different types of urinary tract infections is especially important when considering bladder health and bladder cancer. Recurrent or complicated infections can sometimes mimic symptoms of bladder cancer or make diagnosis more challenging. Persistent infections and inflammation can also impact bladder function over time. Always remember, if you suspect a urinary tract infection, it is essential to see a healthcare professional for proper diagnosis and treatment. They can determine the exact type of infection and recommend the best course of action. Maintaining bladder health involves good hygiene, staying hydrated, and seeking medical advice when needed. Each person's experience is unique, so personalized care is key to keeping your urinary system healthy.